The hearings that we have to be having is for my colleagues on the other side of the aisle to bring in, first of all, this gentleman, Mr. Brad Smith, who is the DOGE healthcare lead under Elon Musk. And I'm going to read from reporting this morning, I believe in Politico. Brad Smith co-founded a telehealth startup called CareBridge in 2019, before in 2021 founding Russell Street Ventures, and later Main Street Health, a rural-focused provider network. He has since sold CareBridge, but he remains tied to Main Street Health, which is subject to regulation by CMS. So his companies are subject to regulation by CMS, and he is the one who is running the reductions in force across Health and Human Services. He worked closely with senior CMS officials in crafting the reduction in force plan, ultimately incorporating suggestions that reduced the overall impact on the agency, a contrast from other HHS agencies where he played a smaller role, according to one of the people familiar with the matter. Smith and his top aide, Rachel Riley, quote, keep everything close to their chest. The playbook isn't clear, whereas everything else is. They are isolationists. I would love to bring in Mr. Brad Smith and, in a bipartisan format, talk about whether there's perhaps a conflict of interest in having the person whose companies, whose business career that he's taken a sabbatical from is subject to CMS. There's a conflict with that when he works with the CMS regulators to spare their jobs in the cuts that he's in charge of. Does that inspire confidence amongst any of you that you are working with regulators who are not subject to fear or favor but are following the evidence? Do any of you think that that is a good way for the federal government to inspire confidence in the business community when someone who could be a competitor of yours, for all we know, who knows what his venture capital firm is going to do next, is going to get preferential treatment by CMS for billing codes and reimbursements? Is that the kind of climate that we want to create in a free and open market here in the United States? I don't think so. I'd also love to ask him about his views on efficiency, because one of the great stupidities of DOGE's actions in healthcare has been conflating the concept of efficiency with return on investment. When you canceled a lease for the Office of Pharmaceutical Quality in St. Louis that employs some of the most highly trained scientists in the federal government to detect toxins in the pharmaceutical supply chain, are you saving a few $1 million in rent payments for the federal government? Sure, yeah, okay, you save some money. Does that have a return on investment when you now have toxins in the pharmaceutical supply chain that go undetected for years, that lead to multi-billion-dollar recalls, that lead to toxicity and illness in the broader population? Over and over again, Mr. Brad Smith seems to think that taking a chainsaw to the gold standard culture and organization of the FDA somehow is saving money, and what it is actually doing is it is a bad investment for the American people. This is the hearing that we need to be having right now, not talking about a great piece of bipartisan legislation that even if we get it right, he is going to take a chainsaw to anyway. And my colleagues on the other side of the aisle won't stand up to him to do anything about it, so why are we even wasting our breath on legislation that won't be enforced?